Imagine sitting at your desk walking your dog or even relaxing at home, and suddenly everything goes dark. Sudden cardiac arrest doesn't wait, doesn't warn, and doesn't discriminate. But here's the truth. Your body does give you signs, subtle, life-saving signals you can't afford to miss. Chest pain, dizziness, even unexplained sweating could be your last chance to act. Every second counts, and ignoring these 6 warning signs could cost you or someone you love their life. Don't gamble with your heart. Watch now. What you learn could be the difference between life and death, and the 5th sign will blow your mind. 1. Chest discomfort or pain.
When we talk about chronic chest pain, we're talking about chest pain that patients have experienced on and off for weeks, months, or even years. Acute chest pain, sort of the chest pain that might be associated with a heart attack, is something that comes on suddenly that often the patients have never experienced anything like that pain or the severity of that pain in the past.
Chest discomfort or pain is one of the most telling and urgent signs your heart may be in trouble. While it's easy to dismiss this symptom as stress, indigestion, or fatigue, doing so can be a fatal mistake. Not all chest pain feels the same, and understanding its variations can be life-saving. The discomfort associated with cardiac issues often manifests as pressure, squeezing, fullness, or pain in the center of the chest. This sensation might last for a few minutes, go away, and then return. It's not always sharp or stabbing. In fact, many describe it as an overwhelming tightness or heaviness, sometimes likened to having a heavy weight placed on their chest. The cause of this discomfort is typically a reduction in blood flow to the heart. This could be due to blocked arteries or an impending cardiac arrest. When the heart isn't receiving adequate oxygen, it begins to signal distress, which the body interprets as chest discomfort. Importantly, this symptom may not always stand alone. It often appears alongside other warning signs, such as shortness of breath, dizziness, or sweating. Women in particular may experience chest pain differently, often describing it as a burning or aching sensation. What makes this symptom especially dangerous is its unpredictability. It may strike during rest, mild activity, or physical exertion. If you or someone else experiences persistent chest pain lasting more than a few minutes, or if it comes and goes, it's crucial to seek immediate medical attention. Don't dismiss chest pain as a minor issue. It is your body's alarm system, warning you that time is running out. Early recognition and prompt action, like calling emergency services, can mean the difference between life and death. Listen to your heart, literally. 2. Shortness of breath. Shortness of breath is a subtle yet serious symptom that can be an early warning sign of sudden cardiac arrest. While it's often mistaken for fatigue, stress, or even aging, this symptom could indicate that your heart is struggling to supply adequate oxygen to your body. Ignoring it could lead to dire consequences. Typically, this symptom is felt as difficulty catching your breath during activities that used to feel routine, such as climbing stairs, light exercise, or even walking. However, in more severe cases, it can occur even when at rest or lying down. Some describe the sensation as feeling like they're running out of air, which can be both physically and emotionally distressing. The connection between shortness of breath and cardiac function lies in how the heart pumps blood. If the heart is weakened or its rhythm is disrupted, the oxygen-rich blood doesn't reach vital organs efficiently. This triggers the lungs and other systems to compensate, resulting in labored breathing. What makes shortness of breath particularly dangerous is its tendency to be overlooked. People often attribute it to other causes like asthma, obesity, or a sedentary lifestyle. However, when this symptom is sudden, persistent, or accompanied by chest discomfort, dizziness, or sweating, it should raise immediate red flags. This isn't just about feeling winded. It's your body signaling that your heart could be in trouble. A failure to act quickly can result in a sudden and catastrophic cardiac event. If you or someone else experiences unexplained or persistent shortness of breath, especially if it worsens over time or occurs alongside other warning signs, don't hesitate. Call emergency services immediately. Recognizing shortness of breath as more than just fatigue could save your life or someone else's. Listen to your breath. It's trying to tell you something. 3. Dizziness or fainting. Dizziness or fainting, while seemingly benign, can be a powerful indicator that your heart is in trouble. These symptoms often suggest that your heart is struggling to maintain a steady rhythm or pump enough blood to meet your body's needs. Recognizing the seriousness of these signs can be life-saving. Dizziness typically manifests as a feeling of lightheadedness or instability, often described as the sensation that the room is spinning. This occurs when the brain isn't receiving adequate blood flow. In more severe cases, this reduced blood flow can lead to fainting, known medically as syncope. Fainting is not just an inconvenience, it's a loud alarm from your body that something could be seriously wrong. The causes of dizziness and fainting in relation to the heart often stem from arrhythmias, irregularities in the heart's electrical system. These can cause the heart to beat too fast, too slow, or irregularly, impairing its ability to effectively circulate blood. Another possible cause is a blockage in the heart's blood vessels, leading to an acute reduction in blood and oxygen supply. What makes these symptoms particularly dangerous is their unpredictability. They can strike at any time, whether you're active or at rest. While occasional dizziness might be harmless, recurring episodes or those accompanied by chest pain, shortness of breath, or a racing heart are red flags. If you or someone around you experiences sudden or recurrent dizziness or faints without a clear cause, don't dismiss it as a minor issue. Seek immediate medical attention, as these symptoms might precede a sudden cardiac arrest. Time is critical in addressing heart-related issues, and acting swiftly could make the difference between life and death. Remember, dizziness and fainting aren't just fleeting moments. They're urgent calls for help from your body.
We know that many other symptoms can be a sign of heart disease. These include breathlessness, shortness of breath, the inability to do exercises that someone could once do quite easily, fatigue even. Patients who come in with rapid heart beats, swelling in the ankles, really just a change in their ability to do their routine activities.
4. Rapid or irregular heartbeat. A rapid or irregular heartbeat, medically known as arrhythmia, is more than just a moment of fluttering in your chest. It can be an early warning sign of sudden cardiac arrest. Recognizing and acting on this symptom quickly could save your life. A normal heartbeat is steady and rhythmic, ensuring that blood and oxygen are efficiently delivered to your body. However, when the heart beats too fast, tachycardia, too slow, bradycardia, or erratically, atrial fibrillation or other arrhythmias, it can compromise this critical function. The result? Your heart may struggle to maintain proper circulation, setting the stage for serious consequences, including sudden cardiac arrest. A rapid heartbeat often feels like your heart is racing out of control, even when you're at rest. It might come on suddenly or persist for minutes to hours. Irregular heartbeats, on the other hand, may feel like skipped beats, or a fluttering sensation in your chest. While occasional irregularities might not be harmful, frequent episodes warrant immediate medical attention. These symptoms can occur due to various underlying conditions, including stress, electrolyte imbalances, heart disease, or structural abnormalities of the heart. In some cases, they may even be triggered by stimulants like caffeine or certain medications. What makes arrhythmias dangerous is their ability to impair blood flow, depriving vital organs, including the brain, of oxygen. This can lead to symptoms such as dizziness, fainting, or shortness of breath, escalating to a life-threatening situation if untreated. If you notice rapid or irregular heartbeats that persist or worsen, especially when accompanied by other symptoms like chest pain or lightheadedness, seek medical help immediately. Monitoring your pulse and recognizing abnormalities can be your first line of defense. Your heartbeat is your body's rhythm of life. Don't ignore its warning signals. 5. Persistent fatigue. Feeling constantly drained, even after a good night's sleep, might not just be exhaustion from a busy lifestyle. It could be your heart signaling distress. Persistent fatigue is a lesser-known but critical warning sign of potential cardiac issues, including the risk of sudden cardiac arrest. Unlike the temporary tiredness that comes with overwork or stress, cardiac-related fatigue is profound and unrelenting. It doesn't improve with rest and often leaves you struggling to perform even simple daily activities. This type of fatigue occurs because the heart, when compromised, can't pump blood efficiently. As a result, your muscles and organs don't get the oxygen and nutrients they need to function, leaving you feeling perpetually drained. This symptom often sneaks up on people, making it easy to dismiss or attribute to other causes like aging, stress, or lack of exercise. However, persistent fatigue linked to heart issues may be accompanied by other symptoms, such as shortness of breath, dizziness, or swelling in the legs and feet due to fluid retention. These additional signs should not be ignored. The underlying causes of fatigue can vary. It might stem from conditions like coronary artery disease, heart failure, or arrhythmias. For women, fatigue is particularly significant, as it is often one of the earliest and most understated signs of heart trouble. If you notice that fatigue is interfering with your ability to function and persists despite rest and healthy habits, it's essential to consult a doctor. Early detection of cardiac-related fatigue can prevent more severe outcomes, including sudden cardiac arrest. Listen to your body. Fatigue is not just a sign to slow down. It's a signal that something deeper may be wrong. Acting on it early could mean the difference between life and a potentially fatal heart event. 6. Sweating without reason. Unexpected sweating, especially when not related to physical activity or environmental factors, can be a red flag for serious cardiac issues, including the risk of sudden cardiac arrest. This symptom, often dismissed as insignificant, is actually your body's urgent signal that something may be dangerously wrong with your heart. Cold, clammy sweat is a common response to cardiac distress. It occurs when the heart struggles to pump blood effectively, triggering the nervous system to overcompensate by activating the sweat glands. This response can make you feel as though you've broken into a sweat for no reason, leaving you drenched even while sitting in a cool, comfortable environment. The sensation may feel like a wave of sweat suddenly washing over you, often accompanied by other critical symptoms such as chest discomfort, nausea, dizziness, or shortness of breath. While it's tempting to attribute sweating to stress, anxiety, or hormonal fluctuations, it's essential to consider the broader context, especially if other warning signs are present. Sudden and excessive sweating is often described as heart attack sweat, because it's a hallmark symptom of acute cardiac events. For some, this may be the only outward sign before more severe symptoms, like chest pain or fainting, set in. Ignoring this signal can delay life-saving medical intervention. This type of sweating is particularly alarming because it often precedes a full-blown cardiac arrest. If you or someone else experiences unexplained sweating, especially when paired with other symptoms like chest discomfort or lightheadedness, call emergency services immediately.
Chest pain due to heart disease can sometimes be similar, but more classically, it's a pressure-like pain, like an elephant sitting on your chest, so much so that it stops you from doing what you're doing. Frequently linked with exertion. So if you're getting pain when you're climbing stairs, walking down the street, exercising, one, you should always stop and rest. And two, it may be linked to your heart. So at that point, you definitely want to make an appointment to see your doctor. If you're ever getting pain in your chest on exertion that's not getting better with rest, then you definitely want to call 911 and get emergently seen by a physician.
Sweating without reason isn't just a harmless quirk of your body. It's a potential cry for help from your heart. Acting swiftly when this symptom arises could save a life, maybe even your own. Pay attention to what your body is telling you and respond with urgency.